All right. Well, good afternoon, everybody. Thank you for taking the time to join. This is open enrollment for Indy Brew. So we're going to talk through the upcoming benefit plans, some of the changes for the upcoming plan year, particularly for some of the legacy Bearded Iris employees. All the benefits that we're going to talk about today are going to go into effect March 1st. And so this meeting is meant to help educate you on those benefit offerings that are going to be presented and offered to you and your family for 3/1. And we have some changes that we're going to talk through here shortly. We have met with leadership over the last couple of months to figure out the best solution for your company. And so today is open enrollment. This is an open enrollment meeting. We'll open it up for questions intermittently, but certainly appreciate those who could join today for being on. So what is open enrollment? What does it mean? This is your time to make your elections for your benefits for the upcoming year. So any decision that you make today and over the next week or two in Rippling, what those decisions are going to be locked in from 3/1 of 24 through the end of February in 25. The only time you can make a change in between now and then is if you experience what's called a qualifying event. So some common qualifying events, if you get married, you have a divorce, if you welcome a child into the family, spousal loss of coverage. If you have any questions on what a qualifying event is, don't hesitate to reach out to Chrissy, myself, or Tara. We're happy to help answer those for you. And this is not an Indy Brew rule or a Sterling rule. This is an IRS rule. So it is something that we have to adhere to. And I realized that I never introduced myself. So everyone who is just listening to me talk, my name is Trevor Holder. This is Chrissy Hoffman. We're with the brokerage team at Sterling Seacrest Pritchard, working with Indy Brew for your benefits. So we are your main 2 points of contact throughout the year. So should anything arise that you have questions on, please don't hesitate to reach out to us. So as you can see on my screen here, what I've shared is this benefit at a glance. So this is an overview of the medical plans as well as the ancillary benefits available to you all and your families. I'm going to go through each of these. There are some changes for the medical plans, and most notably, we're going to be moving away from United Healthcare. So United Healthcare was the legacy medical provider for both groups. We have decided that it makes the most sense to combine as your groups become more integrated from a systems perspective and operations to have a singular medical plan for the whole Indy Brew population. So with that, I'm going to talk through the 3 medical plans, and then once I finish up, I'm going to hit pause and open it up for any questions. So as you can see, you have 3 medical options available to you this upcoming year. The first option, all 3 are copay options. So in previous years, you had qualified high deductible health plans, which you could contribute to an HSA. We made the decision along with leadership to offer 3 copay plans. And so that qualified high deductible plan is being removed from the portfolio for the upcoming year. So all 3 plans have first dollar copays. So I'm going to talk about, when we use health plans, the big 4. So to start off, that's primary care visits. So think about your primary care physician, pediatrician, things of that nature, very routine visits. Those are covered on all 3 plans at a $25 copay. Specialist visits is the second. That is the good rule of thumb is if you go see a doctor and their practice ends in IST, probably going to be a specialist copay associated with that visit. So think cardiologist, endocrinologist, rheumatologist, all those sort of doctors that have a more advanced specialty. The copay is going to be higher on all 3 of the plans at a $75 copay. The other item that's really important to note is the prescription copays. So I'm going to work left to right here so you can see we've got tiers 1, 2, 3, and 4. And then they're outlined by plan. So all the prescription benefits are the same across the 3 plans. Tier 1 are our generic medications. So think about the majority of medications that we consume as Americans fall into this tier 1 category. Those are our cheapest options. The generics are widely available, and you're going to pay a maximum of $10 if you go to maybe Publix or Kroger, Walmart. You may pay less than that. You may pay $2 or $3 for maybe a generic med, but the most you'll pay for any medication in tier 1 is a $10 copay. As you go left to right, tiers 2, 3, and 4, those are medications that are more name brand and maybe medications that attack a certain condition and may be classified as maybe a tier 3 or a tier 4, which is a specialty drug for that treatment. So these medications, as you go left to right, you can see the copays get more expensive. The medications get more expensive as well. So it's just more of a member cost share at time of prescription benefits. Urgent care is number 4 that I wanted to talk about. So urgent care is a $50 copay. So as you go to maybe more, if you have services that are maybe more intense, maybe minor stitches, you're sick on the weekend, your pediatrician is closed, urgent care is going to be covered at a $50 copay. So those are the big 4 that we utilize from a frequency perspective. So let's talk about deductibles, out-of-pocket, and coinsurance. So as you can see, each of these plans, the far left plan, this base 6,000 has a $6,000 deductible. As you move left to right, it goes $3,000 to $1,500, and there is respective coinsurance amounts accordingly. So what is a deductible and what does it mean? Deductibles apply for the major services and items that are more severe that we utilize healthcare plans with. So think about major imaging, MRIs, CAT scans, PET scans, things of that nature, outpatient surgeries, inpatient hospitalizations, anything if you get admitted to the emergency room, if you go to the emergency room. What happens is the deductible is your portion that you're responsible to pay. And once that deductible is met, if it is met, then that is when the coinsurance applies, okay? So all of our copays accrue in a bucket, any deductible expenses accrue in a bucket, and then the item to keep track of, if you have something horrendous happens and you have an awful year, each of these plans has an out-of-pocket maximum tied to each of them. So $94.50 is the most you're going to pay in a calendar year for medical services rendered. The mid plan has $81.50, and then the buy-up plan has $5,000. So how does coinsurance work, right? That's one of the most common questions that we get. If I go have a $10,000 knee surgery, in that example, if I'm on the base plan, I pay $6,000 of that surgery. The remaining $4,000, Cigna's going to cover at 70%. My responsibility is then 30% of that remaining $4,000 bill. So for that $10,000 surgery, I'm going to pay $7,200, and then when I go to have my physical therapist visits, my rehab, I'm going to pay a $75 copay for each of those visits, and then if I hit my cap of $94.50, I'm done for the year. Same applies for the mid and the buy-up plan. So the mid plan, you can see, has a lower deductible, $3,000. 20% coinsurance means simply that Cigna is going to cover it at 80%. My responsibility is 20%. So you can see as you work left to right, the plans that are going to cover you in a more severe nature. So if you have really expensive, something more expensive were to happen to you in the year, you're going to pay more on a cost per paycheck basis, but you're going to be capped from an exposure at time of service. This middle plan, we kept exactly how the mid plan is today with your United Healthcare plans. And this buy-up plan is identical to the buy-up plan that was with the legacy, both groups. So these two plans should look very familiar from a functionality perspective. Really the main difference is this base plan that was adjusted from a high deductible to just a lower cost copay option. So with that, I'm going to hit pause and open it up for any questions. Does anybody have any questions on anything that we just went through?
Why is it called the Buy-Up 1500 plan? Can you explain just the name of that plan and what that entails?
Yeah, so we're real creative here on the benefit side. So essentially, we put it based off of kind of cost per pay. So base plan, if you enroll in the base plan, this is going to be the cost at $39.98. The middle plan, $60.79, and then if you choose to go to the highest 1,500 plan, essentially we call it a buy-up because you're going to be taking more out of your paycheck to get a richer benefit plan. So buy-up is kind of just a loose term. Really, it's all three plans are designed based off your utilization to meet you and your family's needs, but that's why it's called the buy-up. It's just you're going to be paying more for that plan from a deduction perspective. So that is why it's called the buy-up plan. No rhyme or reason other than that.
Got it. Thanks.
Yep. And so with the plans starting on March 1st, one thing I did want to mention before I turn it over to Chrissy is we are going to request deductible credit from United Healthcare. So calendar year is when your out-of-pockets and deductibles run. So your plan year is 3/1. The out-of-pockets and deductibles are going to apply from 1/1 through 12/31. And so anyone who has met a portion of their deductible in January or February, we're going to request that information from United Healthcare and apply it to the deductible on whichever plan you decide to enroll in.
I have a question about that.
Yeah, go ahead.
Because our current plan ran from April of 23 to April or 3/31 of this year. So what you're saying is that we're basically starting mid-year, and so this plan will run to the end of this year, and then it will be on a calendar year basis after that.
No, so these plans are all going to run from March 1st through the end of February next year. So the plan year for the start of all your benefits is going to be March 1st through end of February next year. So Legacy Bearded Iris had a 4/1 effective date. In the move to consolidate, so we didn't have duplicate anniversary dates for Legacy Scofflaw, Legacy Bearded Iris. The move was made to put everybody on a 3/1 anniversary date. The deductible and out-of-pocket calculations are based off of the calendar year, so 1/1 through 12/31.
Is that how it works currently for our United plan, or I was under the understanding that deductible was kind of on that same offset, like April timeline, but maybe I'm wrong.
So the reason that we chose calendar year is so that anyone who has satisfied the deductible for any portion of that for January and February is going to get credit for that. The Legacy Bearded Iris plan is going to terminate at the end of this month. And so all new medical benefits are going to go effective 3/1. So our thought was, let's make sure everyone gets credit for any deductible that they've met in January and February. Even if your plan previously was on a plan year basis for deductibles and out-of-pockets, it's really irrelevant with that plan terminating. And so this way we can at least get credit for any deductible met in the first quarter of this year.
Understood. Thanks.
Yep. All right. So I'm going to let Chrissy, I've done all the talking. I'm going to let Chrissy go ahead and talk through the Guardian benefits. So with that, go ahead, Chrissy.
All right. Hey guys, I'm Chrissy Hoffman. I'm your day-to-day contact. If you have any questions, feel free to reach out. So your medical is changing, but all of your ancillary benefits are staying the same. So we are going to stay with Guardian this year. Your dental insurance, pretty standard. There's a $50 deductible that's on your basic and major procedures. All of your preventive services are covered at 100%. So that's your cleaning, your x-rays, your exam. But anytime you start going into having a filling done, that'll be covered at 80%. Bridges, crowns, that kind of stuff is going to be covered at 50%. You do have a rollover benefit. It's a $250 per year up to $1,000. So your annual maximum is $1,000. If you don't use that every year, you can roll over $250 of that into the following year. Are there any questions on dental? No. Your vision insurance, same thing, is going to be staying with Guardian. If you wear glasses or if you have contacts, always a good idea to take a look at the vision. There are some great discounts that are available. Your eye exams are going to be a $10 copay. Your lenses, which are the part that goes in the glass, and that's the glass, that's a $25 copay. And then your frames, there's a $130 allowance, and then you get a discount off of whatever the remaining balance is. So you get 20% off of whatever that is. So if your eye doctor charges $200, 130 of it is allowed, you get a 20% discount on that extra $70. Contact lenses, you are allowed either contact lenses or new prescription lenses for your glasses once per year. You're not allowed to do both. So if you were to do contact lenses instead of glasses, there is a $130 allowance. And if it is a necessity due to some sort of medical condition, that would pay at 100% after a copay. All of your vision benefits are based on when you have your services done versus benefits being based on the calendar year. So vision's always going to follow when you had your last exam done. So I had my exam last April. I'm not eligible for another exam until April of 2024. Do you have any questions on vision? No? Okay. So the other benefits that are fantastic that your employer offers, there's a $25,000 basic life benefit that your employer pays for. It's no cost to you. So once you are eligible after your waiting period, you get your $25,000 life insurance. When you're going through rippling, please make sure to update your beneficiary information. That's probably the biggest issue that we see when something arises. You do want to make sure that if you got divorced, you don't want your ex-wife getting the money, right? You want to go ahead and update your information on an annual basis. So it's always good to go through the system just to make sure everything's in there correctly. You also have the ability to enroll in voluntary term life insurance. So that is a cost to you. You can buy anything from $10,000 up to $300,000. With anything over 100,000, you're going to have to complete an evidence of insurability if you are a new hire. If you're during open enrollment, any increases, you're going to have to do an evidence of insurability to get approved, and then that would kick in once it's approved. You can, if you elect voluntary life and you have a spouse, you can elect a benefit for your spouse as well. And then you can elect coverage for children, which is also very minimal. And all the rates are going to be based on your age banded. So everything's based on your employee age. And once you go through rippling, everything will be loaded in. You can kind of see how much it would cost to do $10,000 of extra voluntary life insurance versus $100,000. Any questions on voluntary life insurance? Trevor?
So one thing I just wanted to add in there is for the voluntary life insurance, I just want to make sure everybody on the call and anybody who's going to listen to this recording after, so that guaranteed issue only applies if you are a new hire, or if once you satisfy your waiting period and you're eligible to get up to 100,000. If you've waived voluntary life insurance previously, no matter the amount that you try to elect, you will have to complete evidence of insurability in the upcoming year. That's really, I just wanted to point that out. And then Chrissy, you can chat through the disability benefits.
All right. So on disability, if you are to, I don't know, break your leg and you can't drive to work, or if you have a baby, anything that disables you from being able to work, you can elect voluntary short-term disability. You have to be out of the you would have to be out of work, diagnosed medically by a doctor that you cannot work for 14 days, and then your benefits would pick up starting the 15th day. It's 60% of your current weekly salary, and you could receive that for up to 11 weeks. Again, it does have to be based on medical need. You can't just be like, I'm not working right now, I want to collect disability. But if you have something, I mean, I'm currently in a walking boot, but if I wasn't able to drive to my office and I needed to be out of the office, I could file a claim if the doctor said you can't do your job, you can't walk around. That would be a medical necessity if they say you need to be out of the office. So voluntary short-term disability, that covers for up to 11 weeks. And then God forbid it was something longer, then you would have long-term disability that would kick in. Long-term disability is paid by the company. That would kick in on your 91st day. So you do have to satisfy your 90-day elimination period for the long-term disability. And then after that, the long-term disability plan would kick in starting for 91st day up until either you can come back to work or Social Security normal retirement age. After that, benefits get a little funky once you hit that point and you can start applying for Social Security. Do you have any questions on the disability benefits? No? All right. Trevor, you want to talk about enrolling or you want me to?
Yeah, so I'll jump in just to wrap us up here. So everything from an enrollment perspective this year will be done through Rippling. We've included some information here, and I know Tara and Chrissy and myself, we're happy to help anyone who encounters any issues, but everything will be going through Rippling this year from a benefits administration perspective. So you're going to go in, input your information, any dependent information, and then you're going to make your election. So everything we talked about today is a la carte. So if you want dental, vision, and that's it, you can get dental and vision only. If you want medical only, or if you want medical for yourself and then family coverage for dental, it's all a la carte. So certainly you don't make your elections as you see fit for you and your family. I mentioned this at the beginning. If something does happen from a qualifying event, please notify Tara or us within 30 days of that qualifying event. Anything outside of that becomes very difficult. So the good news is about qualifying events, most of which we know in advance. If you know you're getting married in June, or if you're having a baby in June, we know kind of well in advance of when those times are going to be coming. One of the other ones that you can't foresee in the future is spousal open enrollment. So let's say you were enrolled maybe in a spouse's plan and their costs went through the roof. You're eligible at that time to either add your spouse or move back to the IndyBrew plan. So these are some common examples. We did include some information here on how to search for providers. So you can search on the Cigna.com website for doctors, select employer, any sort of details. You can continue as guest. Once March 1st starts, you'll be able to register as a member. You'll have access to your ID card, which I highly, highly encourage. Log in, get in there, because all the ID cards are really kind of moving to virtually. So make sure that you download the My Cigna app, and then we can request paper, but most Cigna is going to deliver ID cards electronically. So really encourage everybody to enroll in either My Cigna, register online, and then once you're registered, all the benefits as you search for doctors, et cetera, it's going to be tied to the plan that you choose to enroll in. So it's just a little bit more intuitive. And you'll also be able to track EOBs, all these sort of things in the My Cigna app. At the very bottom of the benefit at a glance, Chrissy and myself, this is our contact information. So that's our email and phone number. So please feel free to email us with any questions, call us with any questions about anything specific to the benefit process. Darlene Mormon is in our office to assist our clients specifically as it relates to claims. So if you get a bill if you get a claim that you feel like was not billed properly, or if you need help with the prior authorization for a medication, all these sort of items that come up throughout the year, that's what Chrissy, myself, and Darlene are here to help you all out. So don't waste your lunch break or after hours trying to get on the phone with Cigna. Reach out to us. That is what we're here for, not only today, but throughout the upcoming year. So this document will be shared amongst everyone. We're going to save this recording and distribute to watch at your own time. If anything that we talked about today you want to review, But again, I just want to thank everybody for the time today. As you go through your open enrollment elections, if you have any questions, don't hesitate to reach out, and I hope everybody has a great Valentine's Day. So thank y'all for the time.
All right. Thank you.
Thank you, Sam.